They say George Kilpatrick Inspiration for the Nation, celebrating people we feel good about. May is Mental Health Awareness Month, and we're glad to be joined by our partner, Syracuse Community Health, to talk about the services that they offer in behavioral health as well as their outpatient addiction services. So let's talk about what you are specifically doing during Mental Health Awareness Month to make certain that the community knows the initiatives that Syracuse Community Health is undertaking to raise awareness and reduce stigma around mental health and substance use disorders.
Well, we have several individuals who spend much of their time out in the community, making them aware of all the services that we provide. And with the new CEO on board, with one heck of an innovative mind, we're expanding rapidly, both in mental health as well as addictions and other services at the health center. In fact, we recently also added a residency program. But as far as mental health is concerned, we're making it well known in the community that we are now a walk-in service. I think we're the only unit in this community and probably within this catchment area where you can literally walk in on any day of the week and be seen for your mental health services as well.
And let me pause there, Dr. Hines. Did I actually introduce you? So let me just pause for a minute and introduce the brother. Dr. Bill Hines is the Director of Behavioral Health at Syracuse Community Health. Continue, my brother. I just went right into the questioning. I was like, well, did I even say hello to the brother? Did I welcome him into the show? So there we go. All right. Now we're good.
We're so familiar that we just, it's almost like automatic between us.
Right. We so I just start talking. I was like, oh, wait, they don't know you like that.
I haven't seen you in so long. But that's one aspect that was brought on board when Dr. Aslam was here, and as one of the several improvements that he brought to the community as well as to the health center in terms of expanding the mental health services. So a patient, regardless of their abilities to pay, can come here at any point during the day and as a walk-in be seen for any mental illness issue they may have, which will also include services for medications. I provide all the medications for the patients in this program, and we have a staff of expert therapists who take on the patients and teach them what they need to know about how to get through life and to transcend their mental health symptoms. That probably is the major accomplishment we've had here in quite some time, and it is proven to be quite a valuable asset to the community. We continue to have programs on the weekends throughout the weekday to alert people about what we have available as far as mental health is concerned. And of course, it is well known that we have a superb addiction services that's been around for quite some time. In fact, that's how I started at the health center, was with addictions.
Yeah, and so and thank you. May I call you Bill? Because I know like that.
It sounds silly you calling me anything else.
Right. So when you think about it, what are some of the biggest barriers in the community when it comes to accessing mental health and addiction treatment? And I think one of the ways you overcame that is by having walk-in services. But how does your team respond to the need for overcoming the barriers to mental health and addiction treatment?
Well, it is imperative that you have staff members who are not condescending, judgmental, etc., and are willing to meet the patient as you. It sounds almost like a cliche, but it's really true. Meet them where they are. They have to come in and feel like they are facing family. This is home. I know you're going to see me. I know you're going to take care of me. I know you're not going to send me away without the proper services that I need. And with the addition of individuals to help them navigate the social services system, case management, that is also added to their profile so that they can get a comprehensive provision for what they need at that time. So the most important piece, as far as I'm concerned, you must have personnel on board who respect the patient, who understand where they're coming from, the issues that they face in life, and especially the homeless and those who are coming out of jails. You cannot be condescending towards them. You must welcome them with open arms, and you must treat them with the respect that they deserve. And we have a staff that will do that each and every day.
When I think about what you just said, it makes a lot of sense, because to get to the door of the right,
It's
right,
a major barrier.
yeah, I gotta
Becoming oneself to get there. Absolutely, yes.
and then to be welcomed is such a big thing, because I'm already ashamed about. First of all, I'm in denial that I got a problem.
That's exactly right. Yeah, we're
right.
going to help you with that.
Okay, so how do I get to the door, right? To for somebody who's listening, who knows either whether they're a family member or someone, to get to the door, to walk in, to sit down and not feel any certain kind of way, which you say you're making sure that people don't feel any certain kind of way. But you know how it is, Bill. Like, how do I, first I got to acknowledge that I got an issue one way or the other before I even can get to the door. And then now that I acknowledge that I got an issue, then I'm too ashamed to deal with the issue. And then once I get in the thing, I'm too ashamed to talk about the issue. How you help me with that? Did I break it down for you?
That's pretty doggone good. It's a tough situation for the patient. As you say, the first thing is to overcome the denial that they have a problem, and especially if they're compounding that problem of mental health issues with substance use disorders. Once they have the referral here, or even if they don't have a referral here, what they need to know is that whenever you get to that point where you want to speak to someone about either or both issues, and when you come here, we're going to talk about both issues, because these are problems that have to be treated simultaneously, not like we did probably about 15, 20 years ago when we would treat your mental health and then we'll take care of your addictions later. No. What you do is set up a track for relapse to one or relapse to the other if you don't take care of things simultaneously. So when you come in here, we're not going to be judgmental about what is and what is not, and we're going to help you to decide whether or not you have a mental health problem, whether or not you have a substance use problem simultaneously, and show you the services that we have to offer you. And the beauty of it is we can take care of both of them here. So you don't need to see a counselor here and then go somewhere else to take care of a problem. We're going to give you full services right here. That overcomes a bunch of problems for the individual when they know I can come to this unit and I don't have to go anywhere else to take care of all of these issues simultaneously. That is a beautiful picture for them to see. So, but again, the most important piece of it is, again, how are they received when they walk up to that window? So reception has to be on point, and the therapists have to have a heart of gold to receive these patients and give them exactly what they need. Let them express themselves as we pull the information from them and show them what we can do in order to make life better for them. That's how we attack it.
Would you say looking at that, is that the mission of your program in terms of doing what you can to make sure that people feel welcome, and that they don't feel that the addiction that they're dealing with or the behavioral health issue that they're dealing with, that you want them to know that they can get the help that they need?
Absolutely. We want them to know not only that we have the staff who are capable and professional enough to take care of these issues, they're quite competent at that, but the medications that we use will serve as a springboard to a better lifestyle and give them freedom, especially from their addiction process. Mm-hmm. So we use also the terms that you hear in the community is MAT, medication assisted treatment, or MOUD, medications for opiate dependence treatment. So we have all of that available so that when they come in here, we have a menu of options for them. It's not like in the past where
Right.
You make a determination and say, well, this is the program you're going to attend because this is what we have been guided to as far as our evaluation is concerned. No, 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 no. Many times that patient will say, no, I don't want to do that at this moment in time. And then we would say, well, I don't know what else we can do for you. No, no, it's not like that. So we have a plethora of options for the individual to start them where they want to start in order to bring them up to a point where they are willing to accept the fact that they have the issues that we've defined and willing to accept the treatment that we have on board. So the first thing is to welcome them in, make them feel at home, let them see that we have a competent staff and a loving staff and one that will stick with you all the way through your treatment, as well help you with your external issues with the social service systems, et cetera. So it's a comprehensive program that we're going to offer to them when they get here. The other piece that's missing more frequently than we know is primary care appointments. These patients haven't seen a doctor in decades. Well, we've embedded a primary care provider inside the department specifically for our patients. Also, a nurse practitioner who wants to provide mental health for women, but especially OB services as well. She's here also. So we have those two individuals here in addition to the mental health and substance treatment staff. All those services are available to our patients.
Yeah, and I think what I'm hearing you say is that it's a holistic, whole body approach that can that can particularly meet all of the needs of the community, but particularly Black and brown and underserved communities.
Exactly. Yes. We are definitely looking for those individuals. Look where we're stationed. We're right here in your community.
You're right there.
So therefore, we're here because we want to be here and because we want to service this population. Everyone else is invited, of course.
Yeah.
But this underserved population need people like us who care about them, the competent services that we bring in here, the administrative system that's in place to enhance all of these services and bring on board providers who have the right heart and right attitude. You have to start with those guys first, because if they don't have that, these patients are savvy enough to say, I don't want to deal with you because you don't understand me and you think that you're better than me and you don't want me to be here. They'll tell other people. We need people to tell the community there's a great service available for us over there at that health center, and I want my family and my friends to be invited to go there. They will take care of you 100% of your needs, inclusive of your mental health, your substance use, as well as your physical need medicinally.
So what are you seeing in terms of substance abuse or addiction in the community? Are there any recent trends or challenges that you're seeing? And I'm thinking about this because, we got weed on every corner now. And that's and I'm not talking about the legal shops either. So
that's another story altogether.
Right.
I'm not on board with that.
Hold on a second. 1 second. So let me just do something really quickly because we are while we're doing that, let me just change something here. So hold on a second. All right. So are there, you hear things, are there things that are particularly that you're seeing that are making an impact or making a difference in terms of trends?
Well, we are all well aware of the trend with fentanyl and the overdose process that followed, and with the harm reduction efforts that have been put into play by the state and by the health center and practitioners, we're starting now to see a downward trend in that process, but it hasn't gone away.
Mm-hmm.
The numbers were starting to indicate that although it may be dropping overall, it may not be dropping inside of the community. And so those are statistics that I'm trying to get a handle on now, because the services for opiate use disorder continues. I think one of the reasons you're starting to see less overdoses is because we have patients now who have used fentanyl and those substances to the point where they have at least some resistance to the overdose process. It takes a little bit, they have more tolerance. So there are actually now a population of patients who are abusing substances who are preferentially looking for fentanyl, not heroin, because heroin is no longer potent enough for them. So I'm kind of watching that trend. We're still providing services strongly for opiate use disorder. But the other thing that I've seen in the community that really bothers me a lot is that 10, 15 years ago, PCP was primarily used by the men in the community. Fewer men are coming in with the use of PCP, but more and more women are using PCP. And I don't understand why. When you talk with them and ask, what is it about this drug that causes you to return to it over and over again? They like the dissociative feeling that comes with it. That's mostly what I hear from the patients. But the trend for PCP in the community appears to be on the uprise.
And we used to call that angel dust. Is that what it's still called?
Angel dust, yes,
okay.
Absolutely.
Okay.
Yes, that's exactly what we used to call it.
And some people used to call it elephant tranquilizers and things.
That's right.
Okay. So that's what we're talking about. And so, and a lot of people, what they would do is they would put the dust as well on their weed.
On marijuana, yes.
Right. So are we seeing that too?
You still see polysubstance use. There's no doubt about that. And in fact, I gave a lecture yesterday about the club drug scene that we saw maybe several years ago that finally disappeared, raves and those kinds of things.
Raves.
You don't hear much about it anymore, but the substances that define the rave era are still in vogue. They're gone underground. And so we see a lot of patients come in who are still using those particular ecstasy, MDMA, ketamine, those things. They're still being utilized in the community. And you have to be aware of that because those are patients that are going to come to you eventually and in need of help for those problems. So club drug scene, the raves are gone away for the most part, but the substance use of those particular substances continues and it's in the community.
Where does Molly fit into that?
Oh, wow. Molly, MDMA, methylene diethyl, that
people commonly refer to that as a date rape drug. Unfortunately,
it is called a date rape drug, and the reason why is because it acts both as, you're talking about Rohypnol for the most part. Rohypnol is the one that's going to be used as a date rape. Molly is one that can also be used that way, but Molly acts in such a way that it actually draws the person into you. It's not one that really knocks you out like that, whereas Rohypnol really puts the cerebral cortex to sleep while it keeps the brainstem awake. So you still function, but you are unconscious when you take it in the dose high enough that you won't recall what's going on. So it produces antegrade amnesia. And the dosage between what's lethal and what's normal in most circumstances is so thin that it doesn't take much to really take the person over the edge, and apparently can also bring about their death. So Molly, MDMA is ecstasy. Rohypnol is the more prominent date rape drug. Yeah. Ecstasy is the drug that really defined the rave scene. And because of the tactile piece that goes with it and the empathetic piece that goes with it, it draws people together. So that's why it's such a magnificent drug in that scene for multiple sex partners and those kinds of activities to take place, because it draws people into each other. Whereas Rohypnol, GHB, gamma hydroxybutyrate, or what we call Georgia homeboys, what you hear in the street, those things are really the ones that cause most of the date rape scenes that you hear about.
Unfortunate with that. So are you talking with Dr. Bill Hines, Director of Behavioral Health, and talking about the outpatient addiction services as well as the behavioral health services and what trends are happening right now in our community? So a couple more questions quickly. Are there programs and partnerships particularly focused on youth mental health and family-based support services?
At the health center, we offer services for family as well as for young kids. We have a staff that's professionally trained to deal with both. And so we open our doors for that service here at the CAPS department. If there are particular issues that we can't handle or we seem to need additional help with, then we'll make appropriate referrals to the tertiary clinics or outlying clinics where those services will be available. That's rare. Most of our patients can be taken care of right here by our therapists who are both trained in both treatment for adults as well as children. So we provide services for both, and it works out very well.
How do you support families who are struggling to understand or help a loved one facing mental health or addiction?
During the initial process, you must gain their confidence that you can provide the services that are necessary for their loved one and or themselves. Sometimes they come in tandems, husband, wives, or a parent and a child. They have to be convinced initially because most of these patients have been to other services, have seen other people, and have rejected those services for whatever reason. We need to convince them that our abilities to treat their particular problems as well as the problems of their children is expert and top-notch, and that we have the heart and soul that will reach out to them and help draw them in and show them when they're here that we're going to be with them all the way through the treatment process. So they have to see a commitment from us that we're going to take care of their issues.
You know, I was thinking about this. You were thinking we be seeing with young people.
You're breaking up.
Oh, all right, hold on a second. We'll fix that real quick.
Yeah.
I was interested in what you're seeing with young people in particular, and what's coming to mind is the idea of suicide ideation and how to deal with that. A young person who might be experimental with drugs and such and so forth, but how we might, as parents, really recognize when our young person is struggling, because oftentimes the parent doesn't see it, or there might be a sign that they missed. How can you help us with that?
Well, frequently they miss the sign because they don't know the child. That's some of the evidence that we see here, is that if you must spend time with your child throughout their early life so that you have the type of relationship where they can discuss things with you, so that they'll be willing to want to talk, at least with one of the two parents. I want to be able to come to you in confidence and talk to you about these issues. You must learn about the behavior and attitudes that your child is developing, so that when there is a difference in behavior, the first thing that you're going to see with any use of substances, especially, is a change in behavior. I must be so attuned to my child, and I must have a relationship with my child such that if there's a change in what I see in them, I have the right to come and ask questions, and they'll be willing to discuss that with me. Sometimes it's important to, especially if they're living in your house, go check their bedrooms and look around. It's still your house. Oftentimes, frequently, you'll find there's stashes of substances in the house. But the attitude and the change in the behavior is going to give you a lead that something is wrong. At that point, you need to bring that child to us and let us do a more definitive study. And frequently, even though they won't discuss it with the parents and oftentimes won't sign a release for the parent, they will at least talk to us because they recognize the detrimental effects that are coming with that and want help.
What if I don't have a good relationship with my kid? So let's take it to the next level, right?
Okay.
So you just said I don't know my kid, and so what if I don't have what would be considered a good relationship, or a relationship that appears to be beyond repair for whatever the reason, could be some unresolved trauma. It could be trauma within the household around that relationship. And so that disconnect is there. Or you might think you have a good knowledge and awareness, and all of a sudden your child takes their own life and it appears out of nowhere. And I'm sensitive that there may be someone watching or listening that this has happened to, and they make me feel, I'm not trying to make it about what they didn't do, because that's also, talk about that piece, because parents often carry that with them. So can we walk the line about what I need to do as a parent, but at the same time, not hold the guilt of what?
At any point that you have a concern about a change in behavior of your child, and regardless of whether or not that child is willing to discuss those issues with you, the best thing to do at that point in time is to reach out to our services, because frequently the patient will come with you, and although they won't sign a release for you to be in the room and talk, they will address their issues with the therapist. So the most important piece is, regardless of your relationship with the child, try to get the child to come in to face off with one of the therapists. So, and they, once they recognize that it's completely confidential, nothing is going to go to the parent or any other individual unless they give us the authority. At that point, the child will come forward and tell us the types of things that are going on in their life. And if it's trauma at home that's a part of it, they'll also reveal that. And the staff members trained to deal with those situations will make the proper referrals regarding that patient and what needs to happen in order to protect that patient, both mental health wise as well as the physical health. So in many situations, I won't say many, but in enough situations, we will end up having child protective services or other services brought in because of what's revealed by the child. So the relationship could be torn apart simply because there is trauma in the house. There are things going on that affects the child adversely, and they can't talk to anyone else about it but us. So the most important piece is to get the child here to see one of our therapists who can absolutely handle that situation.
Finally, Bill, what's one more thing you want us to do, know, and feel around this issue, and what you think we ought to do to support individuals in our community who may be dealing with mental health or behavioral health issues or addiction issues?
My recommendation would be to other facilities in particular is you must avail yourself of staff members who, first of all, understand the issues that the homeless and others in the community face. And they don't have to be homeless, just anyone who's having a problem with the mental health or substance use or the combination of both, willing to bring them in, take them on, make them feel at home, and provide them with the professional services they need in order to improve their life and to distance them from both their mental illness as well as their addiction process. If you can do that, then we're going to have a greater impact on this community than we've had so far. But you have to have the staff. You can't invite patients into your department and not have the staff on board who are compassionate enough and understanding enough to handle the situation as at hand. They cannot be judgmental about that.
So much more to talk about. We got to have you back to continue this conversation. Dr. Bill Hines, how do people access the services of the behavioral health and outpatient addiction services?
So they can call the health center directly, and they'll be patched through to the appropriate departments, or they can come down to the main center on 819 South Salina Street, come into the CAPS department, and we will direct them to the services they need, whether it's in our department or not. Go online to access the website. That will give you a plethora of information and a huge picture of what we look like and what we do and what we offer, so you'll know exactly how to navigate that system and where to go.
And aside from that, do you also offer straight up counseling for people who are going through straight up, it could be relationship things, or is that a different? Yes. You do? Yes. Okay. So you have all of that. Yes. Okay.
Yes. It's a full course menu of services that we provide for both
therapy, couples. Yes. Okay. All right. So this is good because somebody just asked me today, They're looking for
parenting.
yeah,
Yes,
all of those things. Okay, so
yeah.
it's a full. All right, so wait, before we go, what is the menu?
we do we do individuals, couples. We take care of kids. We also provide for parenting, and we have groups for all sorts of drug and alcohol use disorders. We have MAT services. We have injection services. So you can get your psychotropic medications by injection. You can get your substance use medications either by injection or by mouth. We have a full program to offer medications for those issues. Yes.
All right, Syracuse Community Health online. You can also call the health center. Is it still 315-476-7921?
7921. You got it.
315-476-7921. Come on, Bill. You know Dr. Bill Hines is the director of behavioral health at Syracuse Community Health. A plethora of information designed with you in mind. Inspiration for the nation.
Yes. We love